everybody, welcome to today's video. So today's video, I'm going to talk about what it really means to be a nurse. And for me, it's something that in a way, although it's just your career, it defines you. They train you in nursing school to be an unselfish person and to run for strangers. The reason I'm doing this video is because my husband just sent me a video showing what healthcare providers do in order for their patients to be okay. And yes, there's a lot of liability risk behind being a healthcare provider, but it's also a very heroic and self-giving job. And that's part of the reasons why I didn't decide to become a doctor, because you give your whole life away to be able to do that. But luckily, I'm still able to be in the healthcare field as a nurse and as a future psych nurse practitioner. And so I just wanted to kind of dedicate this video to show you and give you some examples of how nurses give up a lot of themselves to be able to provide the care that they need to provide to all their patients. And so I can tell you a story. I travel a lot with my husband and my daughter, and there was a flight delay, and I didn't bring my work computer with me. As you may know, I work online, so I didn't bring my work computer with me. There was a delay. I was going to have patients the following day, and my coworker, she's good at helping me out, but this time she wasn't going to be able to see them because she had her own patients. And so I'm not able to leave these patients because that's neglect. Not only is it a big responsibility, to make a long story short, what we had to do was drive. So we literally drove 8 hours or 10 hours to be able to come to my house where I had my computer. And although I didn't have much sleep, I still saw my patients. And right after I finished my day of work, then I was able to sleep. But that's the amount of responsibility that us healthcare providers, nurses, nurse practitioners, physician assistant, doctors, maybe even CNAs have for our patients. And I would also include CNAs because I was one myself, and as well as a registered behavior technician. And although it was easier to call out, it was still like a responsibility, and it wasn't good if we did that. And so there's other scenarios as well, like when we were having the COVID pandemic. Us nurses, we were required to get the COVID vaccine if we wanted to go into the hospital. Most of us chose to go back into the hospitals and clinics to help people out, even risking our own health, because there wasn't enough supplies at the clinics and hospitals. There wasn't enough masks, enough gear in order for us to protect ourselves from the unknown. And so these are some of the things that as nurses and healthcare providers we have to go through every single day. And do not doubt it. If there's a code or anything like that, we must act quickly. I know I am, as a healthcare provider, we must move. We must do something to help the patient by critically thinking. If the patient can't breathe, we need to put their bed up or whatever it is. Or we need to perform CPR or call code or give orders to our other coworkers. We have to be in the moment. We have to do it fast. And if we need to run, we are going to run. We're going to make it happen because these lives are in our hands. And although my current position is not that intense, there is so many other nursing positions that are. And when I did my training, as well as some of my working years before, I was able to experience these things, and I just know the heart and the passion that goes into being a healthcare provider. It's not for everyone. A lot of people say, okay, nursing is very competitive. Everybody wants to go in it for the money, but a lot of us are actually giving our heart and are pouring ourselves into our career because that's what it demands to be able to reach these goals of becoming a nurse practitioner, a psych nurse practitioner, a physician assistant, a doctor. It requires you to be a very caring and selfless person. And so that's all I wanted to talk about today. I just kind of want to show you what the reality of nursing is, how heartfelt it is, and how heroic it is in itself. And I love nursing. I'm so glad I chose nursing. I say that from the bottom of my heart because I honestly feel like I'm serving the community. I'm serving people around me. It makes me feel like I'm giving back. And it's just the best feeling I can feel. And it's amazing because I didn't realize it until my husband sent me that video, or like, I think it was the second time I saw that video. The first time I saw myself, and then this time my husband sent it to me, and I'm able to see that I just have it wired in me that if I need to see my patient, I'm going to make sure I'm there. I'm going to make sure they're taken care of no matter what. Even if I feel sick, even if I don't feel okay, even if I'm having a bad day, I am going to be there for that patient. And that is just a character that was built into me when I was doing my nursing training, and that is why I think nursing is one of the best careers that you can possibly choose. And like I said, if you're somebody that's not giving, then it might not be for you, but it's a really fulfilling career, and I think that's very important when choosing your career. And that was it for this video. I just wanted to pour my heart out to you guys to tell you what nursing really is like and what it takes to be a nurse. Thank you. And since you're already here, don't forget to subscribe, hit the like button so other people can see this video. And thank you again for watching this video.